Good evening and many thanks to have you join us here on the health segment of the news with me, Evans Echampon. Now to our stories. Technological advancement has made it possible for parents to register their newborn babies and children at the hospital or at home through the use of a mobile phone application. This means parents will no longer have to travel long distances to the Birth and Death Registry to register their wards. Known as New Automated Birth Registration System, it is robust, cost-effective, as it transfers the information about birth automatically from the site of registration to a central database in Accra.
Around the world, 230 million children have not had their birth registered, while more than 100 developing countries do not have well-functioning systems in place to register key life events such as birth, deaths and marriages. The impact of being unregistered is mostly felt by those who are already on the fringe of society, such as migrant populations or ethnic minorities. Birth registration is the first step towards a legal identity and being able to go to school, get medical treatment, get a job and more. When children are registered and there's documentation to show their identity, they are better protected from early marriage or from being trafficked or forced to work in exploitative conditions. Furthermore, a strong civil registration and vital statistics system means a government will have the most reliable source of data possible on a population at its fingertips. A recent report from UNICEF indicates that more than 4 out of 10 children are not registered at birth in Ghana. Even when they are registered, they do not get access to the original birth certificate, but a temporary one which is used to count the number of babies born at a particular period. About 15% of registered children below the age of 5 do not have a birth certificate, according to the report. Children who are not registered at birth are at risk of being excluded from accessing education, healthcare and basic social services. This is why it has become necessary for Ghana to move from the manual system of application to the new automated birth registration system. Birth registration rates in Ghana has been inactive over the past few years, leaving out more than 35% of all newborn babies unregistered. However, the advent of the new automated system will address the challenge of low-level registration by making the system more efficient, effective and cost-effective. The new system will capture and process birth registration data using tablets and mobile phone technology, which will be monitored and tracked for effective performance. The registrar of the Birth and Death Registry, John Agbeku, said birth registration and a birth certificate are vital documents that give a child an identity and a sense of belonging. He noted, however, that the new automated system will result in massive job cuts at the Birth and Death Registry.
The equity bottleneck study, among other things, identify inaccessibility to birth registration services as a barrier to birth registration and weak ICT infrastructure as one of the major bottlenecks to birth registration. The study therefore recommended, among other things, the use of information and communication technology to enhance capacity, improve service delivery, communication and collaboration.
The Ministry of Local Government and Rural Development, in collaboration with UNICEF and TIGO, are the brain behind the success of the new automated system.
Until now, the number of birth registrations, especially in rural areas of Africa, and for that matter, Ghana, remains low, with an average coverage of only 50% of children being registered at birth.
It is one of the rights of child that UNICEF promotes and enhances. And every child, what UNICEF Ghana is doing with TIGO and Government of Ghana is taking the certification at the community level. Earlier, many of us know that birth registration was an issue because of the paper-based. It took long time. Mothers did not come back or parents did not come back for the certificates. But now it's going to happen there and then.
A consultant at UNICEF, Chris Munga, explained the processes one must go through to be registered under the new automated system.
It's as simple as using the internet or SMS to send the data to Central Accra. There's a dedicated server in Central Accra with a public IP address that receives the data. But that data goes through a workflow. When the registration officer collects the data, the district officer will verify the data, the regional officer will approve the data, and that data will come to the national office for approval for certificate printing. So the system introduces an enterprise solution to birth and death and basically creates a virtual birth and death registry.
The automated system has already been piloted in 15 areas and has seen at least 15% increase in the registration of birth in those areas within 3 months. It is expected to contribute to an improved national average registration rate of 65% of children under the age of 1 to at least 75% by the end of 2017 and 100% by 2020. With this system, parents will heave a sigh of relief when they need birth registration certificates for their children. More so, children will enjoy their rights of being recognized in society and their identity duly acknowledged.